Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Segmental Scruples edition or series. This audio podcast, as part of a Rampage Sonar. This audio podcast, as part of a Blitz Logistics, and this audio podcast, as part of a Storm Logistics production. This audio podcast, in this audio podcast, a little bit around alternatives and indications to RBTs or red blood cell transfusions, and sort of theme three in around this works. So the British Committee for Standards in Hematology guideline on anemia sort of has informed that anemia may be secondary to previously undiagnosed disease and thus would need to be investigated. The prevalence ranges from evidence from the evidence in sort of in some of the evidence ranges from 5% from anything from 5% up to 75%, but this depends upon the population being examined. So in patients or recipients who have long-standing conditions, long-term conditions, and/or chronic illnesses, there is a problem because any potential coexisting anemia or complication relating to potential renal insufficiency, this can increase the probability of patients now needing alternatives and indications to RBTs which need to be established, because ultimately ongoing RBT intervention, red blood cell transfusion intervention or interventions is not us is not indefinitely sustainable. Indefinitely sustainable. Unfortunately, the NHS, the National Health Service, for example, will continue to increase the certain sort of cost aspects around the National Health Service continue to increase as a result of bearing an impact of overall patient care, or overall patient or recipient care. And this needs to be addressed, and certainly there is evidence to suggest that perioperative anemia is a modifiable risk factor for morbidity and mortality. But again, alternatives and future indications to transfuse need reflecting. So recombinant EPO or erythropoietin have proved to be of an immense support in managing anemia due to renal impairment. And other uses are pre-autologous RBTs, the anemia of chronic disorders, for example, rheumatoid arthritis or cancer, some causes of myelodysplasia or myeloma, and acquired immune deficiency syndrome. A low serum prior to prescription, for example, is valuable to understand whether a patient or recipient will respond to treatment. In addition, the marrow requires many other precursors for effective erythropoiesis. Erythropoiesis being the stimulation and the sort of the stimulation in around red blood cell functioning. These can include, so for example, metals and minerals such as iron, cobalt, cobalt and vitamins, and especially, for example, vitamin B12, folate, and vitamin C, vitamin E, and vitamin B6, thiamine, and riboflavin. In addition, hormones such as androgens and thyroxine are important sort of amongst in context of general physiology, and deficiency of any of these constituents can also contribute to anemia. So these should also be investigated as supplementary to a patient's or recipient's care, but also appreciated more broadly as alternatives, as part of alternatives or indications before red blood cell transfusion or RBTs, by potentially where where, for example, clinicians look to prescribe look to prescribe or uh, or implement a certain sort of treatment or care based modalities in those patients or recipients in those patients or recipients. So in each clinical situation, EPO or erythropoietin has inevitably enhanced erythropoiesis and red cell stimulation. However, um, time to time to the initiation around treatment and route of administration and treatment duration has varied broadly between practices, and there is still a sort of a debate in patients or recipients who potentially refuse alternatives even when it can be life-saving, and such understanding prompts sort of prospective works. And in retrospective research, it has been stated or informed that there's no clear indication for a large number of RBTs given, or red blood cell transfusions given. Many blood transfusions appear to be administered because of arbitrary transfusion triggers rather than the physiological need for blood. This pathway for decision making can and will impact on patients or recipients' renal function over time. Blood conservation and adherence to guidelines could significantly reduce RBTs in such circumstances. So the use of EPO to increase erythropoiesis offers an alternative to RBTs, assuming normal responsive progenitor cells and adequate iron, folate, and cobalamin stores. So future or prospective research should examine or investigate whether clinical outcomes for EPO erythropoietin use in chronically ill patients are or is or are important and is or are important. And so because at the same time platelets play an instrumental role or have a role in primary hemostasis, platelet transfusions are often important in managing patients or recipients who are bleeding or at risk of bleeding with a thrombocytopenia or impaired platelet function. Platelet transfusions carry risks, and decisions to transfuse platelets must consider clinical circumstances, because platelet transfusion in such settings may fuel or prompt thrombosis, and worsen clinical signs and symptoms. And more issues for transfusion have been highlighted, even when considering alternatives. Retrospective research also informs a restrictive strategy for RBTs is at least as effective and possibly superior to for example liberal transfusion strategy in some recipients, with the possible exception of patients or recipients with acute myocardial acute MI or acute myocardial infarction and unstable angina. Unfortunately, the study one study unfortunately in one investigation, sort of retrospectively, the one team did not provide or assess alternative therapy or therapies, and in sort of in works, and there was no comparisons between, for example, critically ill and chronically ill with regard to what might work better in the care of patients or recipients in the longer term. And there have been safety concerns regarding the use of erythrocyte stimulating agents, or ESAs, And again, there are signs that the use of RBTs are increasing or have been increasing in in the past amongst the past decade. However, acceptance of minimal hemoglobin values and perhaps soon artificial oxygen carriers may help reduce allergenic RBTs. Research to understand and identify suitable alternatives and indications to RBTs for recipients or patients with LTCs or chronic LTCs or CIs, long-term conditions or long-standing conditions or chronic illnesses has been important, has become had been has importance, and now than it has been in the past decade. And the clinical factors to appreciate renal health generally now needs elaboration. That draws this audio podcast to a close. This audio podcast is part of a Segmental Scruples edition or series. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.